Radio City presents.
So obsessive compulsive disorder can be explained into three parts. One is your obsession. Obsession is basically a very distressing, intrusive, repetitive thoughts that keep coming to your mind even though you try to avoid it. The second part would be what you feel when you're having this obsession is a high level of anxiety. And the third part would be the compulsion, which is basically doing things that will help you reduce the level of anxiety because of the obsessions that you're experiencing. So people end up doing repetitive behaviors to kind of reduce the anxiety that they're experiencing. The symptoms here cause a huge impact on your personal life, your professional life, your self-care, and your relationships. Obsessive compulsive disorder is very common. It affects around 2% of population. Adult OCD usually begins in teens or in early 20s, but people come or receive help after years of suffering with obsessive compulsive symptoms. So the most common symptoms that we see in obsessive compulsive disorder are, first would be obsessions with fear of contamination, which leads to repetitive washing by the patient, as in compulsion. Some people also have obsessive doubts. For example, is the stove switched off? Is my room lights off? And they end up having repetitive behaviors of checking whether they've actually done the job. They might also have some aggressive thoughts or impulses, sexual thoughts or impulses as well. Few people may need, there might be a need of symmetry, and they might carry out their work in a very ritualistic way, which leads them to repeatedly do things till they feel that they've done it in a right way. So at Maarga, we work as a team. We have a team of psychiatrists, psychologists, psychiatric nurses, and occupational therapists who would help you with your problems. When a patient comes in with symptoms of obsessive compulsive disorder, the psychiatrist interviews the patient to understand the severity and the impact that it has on his or her life. And the psychologist does psychological assessment again to assess the severity and understand the patient in a holistic way. Once we come into the treatment aspect, mild forms of OCD, there are some forms of psychological therapies which are really helpful in obsessive compulsive disorder. The most evidence-based therapy would be exposure and response prevention. There is also cognitive behavioral therapy, which helps patient dealing with their thoughts, emotions, and behaviors. There is also supportive psychotherapy, which helps patient manage crisis in their life or changes in their life, enhance their coping skill mechanisms, which basically helps them deal with their anxiety and obsessive compulsive symptoms. Also, psychoeducation is provided to the patient about the obsessive compulsive disorder so that they can handle their symptoms better. Also, the family sometimes needs help. They are also psychoeducated, and their support is highly essential for helping out the patients of obsessive compulsive disorder. Family also sometimes feel very burdened and hugely impacted due to their loved ones going through an obsessive compulsive disorder, for which again we can offer support. The second part is the medications, which involves anti-anxiety or antidepressant medications, which helps patients with obsessive compulsive disorder. The patient might need to take their medication for a long duration and follow the advice of the psychiatrist, follow up with the psychologist for the psychotherapies which would help them with their obsessive compulsive disorder.
Radio City presents Ask Maarga.